Welcome everyone. In the spirit of reconciliation, PKD Australia acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to the elders, past and present, and extend that respect to all Aboriginal Torres Strait Islander peoples today. So hello and welcome to everyone in our PKD community, and thank you all for joining our Q&A webinar tonight on Does Drinking Extra Water Help Polycystic Kidney Disease? Tonight we'll be hearing about the results of this world first study from three of its investigators, Alex Munt, Dr. Annette Wong and Professor Gopi Rangan. So a little bit about our presenters tonight. Alex Munt is an accredited practicing dietitian and research dietitian and has been involved in ADPKD research since joining the Prevent ADPKD team in 2018, supporting Annette Wong by looking after almost 100 participants and collecting the data. Since then, she's established herself as an up-and-coming coordinator and is currently responsible for a number of pharmaceutical clinical trials. Dr. Annette Wong is a postdoctoral fellow of kidney dietetics at the Westmead Institute for Medical Research and an accredited practicing dietitian as well. Annette has over 10 years of experience in clinical research and investigator-initiated clinical trials across the University of Western Australia, the George Institute and the University of Sydney, with many of these in PKD. Over the last 7 years, Annette has been the study coordinator for the Prevent ADPKD trial, developing the study protocol and establishing the study at 13 sites across the country. And Associate Professor Gopi Rangan is a senior nephrologist at Westmead Hospital and an expert in autosomal dominant polycystic kidney disease. As the head of the Michael Stern Laboratory for PKD at the Westmead Institute for Medical Research, Dr. Rangan has been involved in numerous studies into PKD over the last 15 years, and he was also the initiator and lead investigator of the Prevent ADPKD trial. For the past 5 years, he's also chaired the Scientific Advisory Board of PKD Australia. And now it's over to the experts themselves. So I'm going to pass you on to Alex Munt.
Thank you, Carolyn, for the lovely introduction, and to
Very
PKD
welcome.
Australia for hosting us this evening. So tonight, as Carolyn explained, in conjunction with Annette and Gopi, we'll be running through what the Prevent trial was about, what we found at the end, and at the end of all of that, we'll answer your questions. Very excitingly, the results of this study have actually already been published in the New England Journal of Medicine Evidence Journal online. There is a link to the article up the top here. As you can see by the numerous authors, 34 in fact, this was an incredibly big project and there were many people involved. Given the huge undertaking that this project was, we have many people to thank. First and foremost, we wanted to say thank you to the people who generously sacrificed their time and much more over the 3 years to be part of this trial. The trial would also not be possible without the rest of these organisations and people listed here. Many of you here for this presentation will have autosomal dominant polycystic kidney disease, which we'll refer to as ADPKD for short. But we thought revisiting the key details of the disease would be important in setting the stage for our presentation and in turn discussing the results. So autosomal dominant polycystic kidney disease is the most common genetic kidney disease, occurring in around 1 in 1,000 people rather. It is caused by damage generally to one of two genes, the PKD1 or PKD2 gene. The damage to the gene is inherited in most cases, but in 10% of people with ADPKD, there is no family history. The damage of these genes leads to growth of innumerable cysts in the kidneys, which slowly expand over time. This leads to symptoms such as abdominal pain due to the size of the kidney. So we can see on the left here on this diagram that the polycystic kidney is much larger than a healthy kidney. And in addition to that, blood in the urine and hypertension. ADPKD is the 4th most common cause of renal failure in Australia. There is no cure for ADPKD, but there are existing treatment options that revolve around lifestyle that we know can make a big difference to the trajectory of disease. Some of these interventions include ceasing smoking, maintaining a healthy weight, reducing salt intake, being on top of your blood pressure, aiming for 130/80 or lower, cholesterol and blood sugar levels. There may also be times when medications, such as blood pressure medications, are needed to help with this, and also times where tolvaptan may be a suitable option.
So the next part I'm going to address why did we spend 5 years doing the Prevent ADPKD study, and what was the theory behind it that led us to doing this actual study. So just to go through our physiology and the background behind it, our bodies usually produce this hormone called vasopressin. It has another name also known as antidiuretic hormone, and its main role in our body is to regulate the amount of fluid that's in our body. So, for example, if we experience dehydration, our brain would detect this and produce vasopressin, this hormone, and release it into our bloodstream. And you can see here it's shown with the letter V on our slide. When this hormone travels around our body and arrives at the kidneys, it signals the kidneys to reabsorb more water back into the body so that it produces less urine and prevent further dehydration. So that is also why our urine appears a bit darker in yellow when we are dehydrated. However, in people with ADPKD, this hormone vasopressin, when it arrives at the kidneys, will also make the cysts in our kidneys grow. So we thought to ourselves, if people with ADPKD drink enough water to stay adequately hydrated so that less vasopressin is in their body and their bloodstream, then hopefully this would mean that the kidney cysts won't grow as quickly. Okay. So Dr. Rangan, before we started the Prevent ADPKD study, Dr. Rangan tested this theory in an animal model with PKD. And the results were positive, confirming that those animals who drank more water had smaller kidneys than those animals that drank less water. However, another group, research group, who conducted a very similar experiment, however, they used different types of PKD animal model, didn't show the same results, so they were a bit more conflicting. So we believe that doing this study is very important to provide clarity to people in the community of ADPKD. At this stage, there was still a small handful of short-term studies that were only up to about 12 months in duration that were conducted in people with PKD, but they did not provide us with solid information on whether it slowed the growth of the kidney cysts. So most of these studies didn't use MRI scans to measure the size of kidneys over time, so they were not as informative as we wish they would be. Also, drinking water is a very easily accessible option for many people. And if it works, it's very cost effective as well. So we thought that it really deserves us to investigate the time and spend the time on it and find out if drinking extra water is safe. Furthermore, this Prevent ADPKD study was recognized by consumers, PKD Australia, and other experts in the field and funding agencies about how important it is to address this study. So we went ahead. So this ultimately led us to the aim of the Prevent ADPKD study, which was to determine if drinking extra water slows down kidney cyst growth in people with ADPKD.
So from December 2015 until June 2017, 1,538 people with PKD were screened for eligibility, of whom 276 people consented and attended the first study visit for screening. Following screening, 184 people, those who met the eligibility criteria, such as being between the age of 18 and 67 years old, and with a kidney function of more than 30% were included. Half were randomly assigned to the usual water intake group, and the other half to the prescribed water intake group or extra water intake group. Those people who were screened were all from all over Australia. This is a map showing our 13 sites around the country and where we could find photos, the local study nephrologist for that site. I think one of the most special things about this trial, and certainly we've got some of the participants listening in here, is that our study team travelled around the country to see each of our participants individually. So Annette and I, whose faces you can see here in the centre of Australia, we got to know everyone really well, and we really value those relationships we created. I still actually remember one Monday, Annette and I decided to really test our limits, and we flew from Sydney to Perth and back on the same day, and we saw 6 or so participants in between.
So we did ask our study participants to do quite a few tasks over the 3 years, and this is what they did, and we really thank them for their commitment. So every 6 months, they would see Alex or myself in person until COVID hit. And we were lucky that COVID hit a bit later in the trial, and we already got to know all our participants very well. So then when COVID hit, we had to switch to phone calls, but the participants still visited their local sites to have their measurements taken, such as blood pressure, weight, etc. Every 6 months, each of the participants also completed a 24-hour urine collection, which represents how much water that they would usually drink. And from those 24-hour urine collections, we also measured the urine concentrations. They did blood tests every 6 months to measure kidney function. And they also completed important questionnaires addressing issues such as quality of life and pain. Now, the most important task that our participants completed was the MRI scans that they did at their local radiology centre. And they did it 3 times over the 3 years, at the beginning, at the middle, at month 18, and then at the very end at 3 years. These MRIs are very important to answering our study question. It allowed us to measure your total kidney size, and also which is representative of your cyst size as well. And it is a lot of work every 6 months doing all this. And to highlight the dedication of our participants, Alex and I remember one participant who was driving her 24-hour urine collection to drop off at the local pathology centre. And she's done it, she's got it with her in the car, and suddenly she had to hit the brakes pretty hard. And unfortunately, it did go everywhere in her car. She still drove the remaining collection to the pathology centre. And this really shows that the amount of commitment that our participants had was what really made this trial possible, and also for us to have results to announce today. So now, for those participants who were assigned to the extra water intake group, they had a few additional things that we did with them. So every 6 months, we would assess their diets, especially to see what their salt intake was like. Now, the reason why we did this is because if we eat too much salt, then we need to drink more water to dilute it back down in our bodies. So for some people, we will, other than discussing just water intake, we would discuss salt intake to help them achieve their goals. So for us to calculate the water intake prescription that we advise each individual in this group, this is how we did it. So we would take the urine volume from your 24-hour urine collection and also the urine concentration from the same collection, put this into a special equation, and this will tell us how much the person should be drinking each day to reach their target urine concentration level. Now, if the individual is already at target, then we tell them to keep going and drinking and eating as they are. However, if the participant is not at target, then we will provide some coaching on how they can increase their water intake throughout the day where needed, and how to reduce their salt intake. Now, we provided some additional tools because it is something that we are asking people to do every day. So in between visits, and depending on the person's progress, we might encourage them to use urine dipsticks to measure the urine concentration in the afternoon, or alternatively, we might also send you some text message reminders to keep up with your water intake or reducing salt here and there. So we did really tailor it for everyone and each person, and this process would repeat itself every 6 months for that group.
So thanks, Annette, for going through the study, and Alex and Carolyn for the kind introduction, and also to PKD Australia for giving us the opportunity to share these results with you. And I'm going to go through the next 15 minutes or so just to take you through all the main results. I'll try and go slowly so I can explain all the different results, because I think they're quite important to understand. And what I'll do is then finish off with a summary and give you some take-home messages or key conclusions. The first thing to let you know is I think, as Alex and Annette have pointed out, the study was a huge undertaking, and it was really well conducted. I'm I guess the lead investigator, but really to see this come to life and see it so well conducted, it certainly makes us very proud of Australian research, and we're very grateful for your support. So the first thing I can tell you is that 86% of people completed the 3-year trial, which is actually a very good outcome for a study of 3 years of length, because a lot of things happen to people over 3 years, and sometimes they can't continue. But the fact that 86% completed the study is a really good measure of success. This slide here is a graph of urine volume, and it gives you the average urine volume over the 3 years. You can see that there's two lines. There's a blue line and an orange line. The blue line is a group of people who are in the extra water intake group, and the orange dotted line is the people who are in the usual water intake group. A couple of things to mention. These results roughly equate to about 1,000 urine collections performed by all the people who are in the trial over the 3 years. So quite a lot of samples here to analyse. Urine volume is a measure of fluid intake, because whatever you drink, it's a volume that comes out. So if your urine volume is 2 litres a day, you're roughly drinking about 2 litres of fluid a day. So keep that in mind, because we'll be talking about urine volume as being a measure of fluid intake. So there's 2 things I wanted to mention. The first one is that when you look at the start of the study, you see where the blue and orange line start. And if you look at the vertical axis, which shows you the amount of urine volume, or amount of that people drank, you can see that the average is about between 2 and 2.5 litres, which meant that people at the start of the study were already drinking between 2 and 2.5 litres. And you might ask, why is this important to point out? And it's really important because if you look at the general healthy Australian population, only 2 out of 10 healthy Australians will get to that level of drinking 2 to 2.5 litres. Most of us actually drink about 1 litre or 1.5 litres. So people coming to the study were already drinking good amounts of water. The second thing that I want to point out is that obviously you can see that the blue line is higher than the orange line over the 3 years, which confirms that people in the extra water intake group did in fact drink the extra water that Annette and Alex asked them to do. And on average, that was about 600 mils of extra water a day. So the usual water intake group maintained their fluid intake around about 2.5 litres per day. And the people in the extra water intake group got to about, on average, about 3 litres of fluid a day. So this is really important to explain because, what we're relying on here is getting people to change their behaviour. And as we know, it's not always easy to change someone's behaviour, even if it's something as simple as water intake. And drinking 3 litres a day isn't easy. It's quite a lot of water to consume. And it's important to probably reflect on why we were able to achieve that over the 3 years, because I think that's quite an important result. And the first thing is, I think people in the study were motivated to drink. They were already drinking relatively a large amount when they came, and they were willing to see what would happen. And so the group were very motivated. In parallel, the excellent coaching and support provided by Annette and Alex was instrumental. And also, as Annette pointed out, the monitoring they did at home, so measuring their urine-specific gravity or the urine dipsticks, all of these things were helpful. And quite a few people have told us that looking at this graph it's quite extraordinary, because to be able to do that sustained period of time is a big effort. So the summary of the slide is that basically people in the extra water intake group achieved their fluid intake, and they had more fluid intake than the usual water intake group. This slide is a slide about urine concentration, and you'd expect that if people drank extra water, their urine will be less concentrated or more dilute. And that's exactly what this graph shows. Again, on the vertical axis, you've got urine concentration. So as the numbers go up higher, the urine becomes more concentrated. So the higher the number, the more concentrated the urine. And along the bottom, the horizontal axis, you've got time again. Again, if you look at the blue line is lower than the orange line. So the extra water intake group had a less concentrated urine that was sustained over the 3 years. One thing I wanted to point out to you was, if you look closely at the numbers on the vertical axis, they go from 0 up to 500. And I won't go through the details, but what we were hoping that we would get to would be an average urine concentration of around about 270, if you like. And you can see here that the blue line, the people in the extra water intake group almost got there, but not quite. So they were about 300 on average. And this is a small difference, but the only way we would have got even lower or got people to drink to get a more dilute urine was to get people to drink even more. And for some people that might have been possible, but for others, it wouldn't have been possible. So I'll move on. So this next slide is about the key results of what the extra water intake did to kidney size and also kidney function. And so this slide here is about looking at the changes of kidney cyst growth over the 3 years. And in our study, as Annette pointed out, we measured kidney cyst growth by measuring the size of each kidney using on the MRI scans. And this was done by measuring the kidney in 3 dimensions, and we come up with a value called kidney volume. And this graph shows you the kidney volume plotted over the 3 years. And as Annette mentioned, Alex mentioned that there were 3 measurements, one at the beginning, which we call baseline, second measurement at 1.5 years, halfway through the trial, or 18 months, and then a final reading at the 3 years. Now, what this graph shows is the rate of kidney volume change, or the growth of the kidney over the 3 years. And you can see here, we've got at the 18-month time point and at the 36-month time point, you can see blue dots and orange dots The blue dots represent an individual or a single person and their value, and they're in the extra water intake group. And the orange dots are those who are in the usual water intake group. The dotted lines are the averages of everyone in the group at both of those time points. So the people in the usual water intake group, their rate of growth was 7.8% percentage points. And the people in the extra water intake group was 6.8%. So the difference was small. It was about 1%. And you can see that, you know, just looking at all the data points, there's quite a lot of variation. And so with that variation, you can't conclude that there was a difference. So we would conclude that there was no difference between the groups. So the conclusion from this key result was that drinking the extra amount of water did not make a difference to the growth of the kidney. This second result is looking at kidney function, and this is measured by a blood test, a simple blood test that your nephrologist and your family doctor does all the time. And it comes up as a particular name. It's called the eGFR, or the estimated glomerular filtration rate. And it gives you an idea of what the overall someone's kidney function is. And this measurement in our study was measured much more frequently than the MRI scans. We did it, as you can see down the bottom, at least every 3 months in the first year, and certainly every 6 months in the rest of the study. So there's a lot more data points to look at. Again, looking at the different time points, you can see that there's the orange and blue dots again. The orange dots meaning the usual water intake group, and the blue dots meaning an individual in the extra water intake group. And the dotted line in the middle is the average of everyone. There in fact is, although you can only see one line, there is in fact two lines there, but they're on top of each other. And so the change in kidney function over the 3 years did not change. So both groups had a similar change in kidney function over the 3 years. So that drinking the extra water did not change kidney function over the time period. A very important part of the study was to determine whether drinking extra water was safe. And very, very rarely, when people drink a lot of water, the sodium level in the blood can decrease, and very rarely when someone's drunk an extraordinarily large amount of fluid, it can sometimes be dangerous. So we wanted to be sure that the interventions that were being done in the study, that they were perfectly safe. And we took extra measures to measure blood sodium in people who are in the group on a regular basis. And that's not a special blood test. It's a blood test that's done when you measure kidney function. It's done in the same sample, so it's very easy to do. And overall, we found that 10 people in the study had a low sodium level, but all of these levels were very, very mild. They disappeared, they were reversible, and no one experienced any symptoms, and there were no other safety issues at all. So we concluded that drinking the extra amount of water was certainly safe. So we covered quite a lot of information so far, and I might just recap and go through some of the key points of the results. And tonight, I think we're sharing with you the results of the first long-term study of water intake in people with ADPKD. And the big question that all of us have been wondering, you've been wondering, we've been wondering, is how much water to drink, and whether drinking extra helps treat polycystic kidney disease. We often get questions many years ago on how much should I drink, what should I do? And we've been unable to answer that question. So the three messages that or the key points from our results that I want to share with you is that first, as I mentioned to you, people were already drinking between 2 and 2.5 litres at the start. And part of that is probably is that many people were already told maybe water intake may be good. And so, as I mentioned to you, most healthy Australians don't get to that level. So I think this was, the people in our study were highly motivated. They probably were attracted to the study because of the water intake. So certainly they were already drinking, good amounts when they presented, when they started the study. The important thing that we can conclude from the study is that drinking more than 2 and 2.5 litres, for example, going on average up to 3 litres, did not make a difference to kidney cyst growth or kidney function. But we did find that if people did drink up to that level, that it was safe. So what are the take-home messages for you? And the first thing I wanted to mention is that it's very important to think about these studies, about who was in the study. So the people in the study were people who obviously had polycystic kidney disease, but they had more than 30% kidney function, as Alex mentioned. So the main messages of the study apply to people in that situation, so people who've got kidney function more than 30%. And so we would say, firstly, that keeping hydrated is still very important for people with polycystic kidney disease. Our study doesn't disprove that lesser amounts of water, that are okay. The conclusion would be that keeping hydrated is still important. And you might ask why? Because all those reasons that we talked about in the beginning that Annette went through about vasopressin levels making cysts grow bigger, they still apply. And we know that keeping hydrated is still very important. And certainly also there are other reasons to keep hydrated. About 10% of people with polycystic kidneys can get kidney stones. We know that there's really good evidence that keeping hydrated can prevent stones. So the conclusion, though, what we can draw from this study tonight is that for most people, drinking around about 2 litres is fine. And drinking more than that probably doesn't make a huge difference. But as I mentioned with these studies, these are studies done on averages. So the conclusions we're reaching is a group of people. And so when we're talking about an individual, for example, your own situation, it can be very different. And so when you apply these conclusions, it's always good to check with your own doctor about what applies to you. For example, if you're working outside and it's summertime, obviously you may need to drink more than 2 litres. And if you're exercising, you might need more. It's very important also to think about your medical situation, because your situation might be very different to someone else's. And so giving, general rules is sometimes difficult. An example might be if someone's receiving dialysis, then 2 and 2.5 litres is too much. If you're, for example, taking tolvaptan, maybe drinking just 2 litres isn't enough. So always have to keep in mind that these are just general statements we're making today on the overall conclusions of the study, and you always need to check with your own doctor about your situation. You might also be wondering, if I am drinking 1 litre a day, should I drink more? And this is a bit of a complicated question to answer, and it really depends on your situation. And again, we'd recommend that you talk with your doctor before making that change. The amount of fluid that you drink and the water that you drink is just one part of the equation. And, we're concluding today on the results of this study, but remember that many different things are needed to treat polycystic kidneys. And so, as Alex mentioned, they all work together. And so doing them together can be beneficial for your health. So not smoking, following a healthy diet, keeping a healthy weight, watching your blood pressure, seeing your family doctor and kidney specialist regularly is very important. So I'd like to just finish off by, again, giving our thanks to PKD Australia, Robert, Carolyn, all the members of PKD Australia, really for the opportunity, the generous opportunity to speak with you today. And I'd like to also mention that PKD Australia has really helped and supported us every step of the way. We're enormously grateful for their support in many different ways. A special thanks also to Annette and Alex for their presentations tonight, but also particularly their hard work and dedication to the study over the last 5 years. As I was mentioned, this has been a really well conducted study. Every single aspect, their care in following through with everything has just been amazing. And I think, as I said, it's getting people to drink that extra amount for 3 years. It's not an easy feat, and I really give thanks to them. I'd also like to thank all the people who volunteered to be involved in the study, all the doctors and staff at all the study sites. You've made the study successful and really helped answer an important question. And we hope that tonight's presentation was useful for you, and Annette, Alex and I look forward to answering any questions that you might have in the remaining time. Thank you.
Thank you so much, Gopi. That was so interesting, as I'm sure our attendees found it, and we've already got a lot of questions coming through. I believe I had a few that have come in advance, so I might just go through those quickly with you, and then we might go on to the live questions, and we'll try and get through as many as we can. Obviously, we're on a time limit, so anything else we can always pop on the website and send out also. So I'll start with the few that have come in advance. They were from a couple of people that couldn't attend, unfortunately, tonight, but we will have it on the video. So the first one is, can the intake of any other drinks, for example, coffee, alcohol, or any other liquids, lessen the effect of the optimal amount of water, and whether it follows up that you can make up for those other liquids with additional water intake?
Carolyn, thanks for the question. I'm going to defer to the expert, Annette, to answer that question.
Oh, sure, I can answer that. Just before I answer, I just want to say, scrolling through all the participant names, I haven't seen you all for a very long time, and it's just so great to see all your names here tonight, and thank you very much. So in terms of other drinks and contribution to optimum amount of water intake, with beverages and drinks that are very high in protein or have diuretic effects or dehydration effects, such as coffee and alcohol, they can reduce the level of hydration that the drink can provide. So things that are like protein drinks, milk-based drinks, milkshakes, coffee and alcohol will diminish that effect. So we do ask people, like during the extra in the extra water drinking group, to drink a little bit more water to make it up. That can be done, and you can make it up with other drinks. So for example, some people really didn't like to drink water, especially in cold weather. So then we would ask them to drink things like tea that's mostly made of water and not much milk in it. And those can be good substitutes for those situations.
Thanks, Annette. We have another one here. Can you drink too much water if you have PKD but are otherwise healthy and symptom-free?
Yep, I can take that question, Carolyn. So it is possible to drink too much. It really depends on, so there are situations where some people have actually drunk many, many litres and it's led to a low sodium level, which, as I mentioned, can be dangerous. There also, as I mentioned, there may be particular situations for a particular person, such as kidney function declining, coming close to dialysis, getting fluid retention. So it's always important to consult with your doctor about about that fluid intake and how much to drink and whether it's safe for you.
Thank you so much, Gopi. I've got another one here. Having been on tolvaptan for a number of years, I've become accustomed to drinking lots of water. As my kidney function has fallen below an eGFR of 20, my renal specialist has suggested I discontinue this, although I am still drinking around 4 litres of water a day. When I begin hemodialysis, I will have to restrict fluid intake. So that is not such a shock to the body. Do you think I should start reducing my water intake now?
I'd recommend that you speak with your nephrologist. Again, he or she's recommended to reduce intake. So it's based on your clinical situation. And so it's very important to get that clinical advice to make those decisions. And I think the question really emphasizes how the amount of water that you need can change depending on your kidney function over time. So there may be a situation where your fluid intake can be 2 litres, but later on, it might not need to be reduced, or really depends on the circumstances.
Thank you, Gopi. We have one more here from the advanced questions. Is it possible that people in the usual water intake group were super conscientious and skewered by the comparisons or results drawn by the study?
Yes. Alex, what are your thoughts on that question?
Sorry, I was just getting to the slide. Can we repeat the question?
Yes, absolutely, Alex. Is it possible that people in the usual water intake group were super conscientious and skewered by comparisons or results drawn by the study?
I think that goes back to what Gopi had said previously. Our participants were already drinking a significant amount of water in comparison to the general population that don't necessarily have PKD. And this may have been because their nephrologists or their family doctors had advised them to drink plenty of water, and they ended up drinking 2 to 2.5 litres of water. So absolutely that plays into our results. We do have a few questions here relating to that. So if the control group were only drinking 1 litre a day, if we can compare that then to the extra water intake group. Gopi, or Annette, do you have any more to add on that? That's certainly something that we can delve into in some post hoc kind of analysis. But if you have any insights into whether we would have seen different and perhaps even more significant results if we had a control group of people only drinking 1 to 1.5 litres a day.
Yeah, Alex, I agree with you. And probably one of the points to make is that in that graph that we showed you before, the separation of the urine volume, so that at least demonstrated that there was a difference between the 2 groups. But as Alex pointed out, the group in the usual water intake were already consuming a good amount. And definitely we've discussed, I guess, looking at this information later on to look at more, what about the people that drank only a smaller amount compared to people who did get to higher volumes, whether that's going to make a difference. And so that detail will require a bit more further analysis.
Yeah.
And we'll be able to let you know, I guess, next year when we have more information.
I just want to add to that even at the beginning when Gopi and I were discussing sort of the design of the study, I think this was something that surprised us as well when we saw this result, that the orange line representing people in the usual water intake, that they sustained that level of intake throughout the 3 years, because if they had a higher intake at the beginning, I guess we could have been expecting that because they're part of a trial, everyone's keen and at the beginning. But a lot of the time in scientific literature is that we find that people's behaviors don't always sustain over a long period of time, which 3 years is a long period of time. So we are surprised, and we are, also glad that we did this the way we did, because now we find out that people with PKD just already can drink quite a lot without a lot of input from us or needing to be in a trial, but just to have the evidence to see what you guys are doing normally is very interesting, and it really informs us for future studies.
I also, yeah, I agree, Annette. And one of the other things to mention also is that we didn't want to create a study that was artificial and that wouldn't apply to the real world. And so the usual water intake was very important to us to just, as Annette mentioned, to continue, what you're doing, but to see whether we can do something else to help. And that was one of the objectives of the study, is what can we add extra to what's being done already.
Carolyn, if it's okay, I might jump in really quickly.
Absolutely. I can see you've been answering some questions, Alex, so thank you.
Yes, sorry, just any quick questions or any thank yous I've just been typing back to, but I just wanted to jump in because I've brought up a slide that relates to quite a few questions. So Caroline, sorry, if you don't mind, I'll read them out.
Absolutely, so, please go for it. Thanks, Alex, thank you.
No, that's okay, just because I know where the data is. So one of the questions, and Gopi, this might be for you, what caused the one person in the orange group that had a reduction in kidney volume by almost 25 points? So I imagine they're referring to down here.
Absolutely. So there are some unusual things in the data that we'll need to go back and have a look at. For that particular person, I have looked through that person's data or that information. We don't quite understand why that's happened. And so we'll need to go back and analyse why there's that variation. And you can see also there's the orange cross up the top as well, which is another person that seems to be a little bit out of the normal about what's happened. So both of those people, there are some aspects to their situation, and we'll hope to learn a bit more about them in the next month.
And there's another couple of questions related to this. Do you think if these results are extrapolated over a longer period of time, there would be even more of an impact or difference between the two groups? And again, slide 16 showed the percentage difference of growth over 3 years as 1%. It appears from the graph that further time would have increased the delta. Is that assumption correct?
It's a difficult one to conclude. What we could say is that what we call the effect size, or the difference, there's a lot of the difference between the two groups was small. And so what we can conclude from the study is that if there is changes with longer follow-up, they are going to remain small. And we don't know, I guess, that information to be able to conclusively answer that question. I think it would be useful to keep going, to able to follow up the people in the study with even a blood test to see what happens, but we don't know the answer.
Carolyn, I can let you take over now, sorry.
Okay, no problems. Thank you so much, Alex. That was a good one. I've got a couple, we've got quite a few that are coming through now, which is fantastic. There is one, were there any findings or discussions about the effect of extra water on cysts on the liver or any other organs?
That's a really good question. We haven't looked at that and we don't know. So people had an MRI scan, which would have, for most people, would have covered their liver, and we're intending to look at that, but we haven't examined the information yet. We wanted to, I guess, with this trial, really get the study done and get these results out to distribute to you, but there's still a lot of work to do. So we hope to be able to give you more information as time goes on.
Still a work in progress, absolutely. So I've got another one here. According to the result charts, there were many participants that had a reduction in kidney volume. Were there anything special about these people, such as lifestyle or any other aspects of their life?
Yeah, I think that's a really, really important question that a trial like this will be able to address, because one of the good things about studies like this that are sponsored by NHMRC, that are funded by governments is that we have access to the data to be able to interrogate and look and try and find out a bit more. But again, we don't have that information for you tonight. So yeah, I'm really sorry that, but it will come.
Okay, I'm just going through some more questions. We have so many coming through. Do we have any future studies planned in this space?
Not from at the moment that I'm aware of. I think this has been a study that's been, 10 years ago, people had written a lot of things. Some of the experts had said that it's going to be a very difficult study to do. And for so long. And so I think we've answered a very important question. I think probably the most useful things will be to go back and look at the data that's already been collected, and to, as people have already said tonight, why did some people behave in a certain way? Why did their kidney volume change? Is there any, what happened to them and why did it happen? Annette, do you have any other comments?
No, I think you've covered it.
I'm just going to jump in as well, just in reply to, sorry, Carolyn, I'm just going to jump in reply to one comment here. Actually, for a rare disease, our sample size was very large. This is the largest study that has been done in water and PKD. Annette mentioned a few preclinical studies that had only been done, and clinical studies, but only done in very small sample sizes, in tens of people previously, and or in rats, and will only have a very short duration. So we do believe that this was a very extensive, large study, and it has provided us with as best conclusive evidence as is available at this time. And that's really important. Yes, there are caveats with studies and lots of nuances to understand, but our messaging remains the same, that you don't need to be drinking more than 2.5 litres per day for your kidneys. So yeah, I just wanted to address that comment. This is a very, very extensive study, and the sample size is incredibly large for a rare disease. And
in particularly for a lifestyle intervention, there are drug trials with many more people, but they are looking at a very different thing to what we're looking at with interventions like what we're doing here that's relating to lifestyle, and it's solely dependent on the individual participant to be able to execute what we intend to implement, and the support that we provide to them is, Alex and I love it because we get to see and get to know these participants really well, and sometimes even their families very well. But the intensity of it is quite large. But we are very happy that we were able to go across to different states and reach out to many more people. As Alex said before, we did screen about 1,500 people at the beginning, but once you kind of look at people's age, where their kidney function's at, whether they have time available to do it, getting down to 187 took us 2.5 years to find everyone to commit.
Thank you for explaining that, Alex and Annette. I think a couple of people were interested in that in their questions, so that explains quite a lot. Perhaps just a couple of more questions if you have time. We've got one here. Based on your findings, drinking extra water does not significantly slow down cyst growth, improve kidney function. Would you say that reducing salt intake is more important in managing ADPKD?
So we would still say that fluid intake is important, as mentioned earlier. So it's important to remember that the study was done with people who are very motivated to drink. So they drank, they were already, fairly hydrated, and we've concluded that the extra above that level doesn't provide benefit. Dietary salt intake is another part of the equation as well. So there's definitely good evidence that reducing dietary salt is important for slowing down cyst growth. So that in combination with blood pressure control, keeping a healthy weight, keeping hydrated, they're probably all important things. So I think what we're saying tonight is that they're all important in the overall care, in your overall care. So dietary salt is really important as well.
Thank you, Gopi. And thank you, Annette and Alex. Are there any other questions? I know you can see them as well. And Alex, you've done an amazing job answering almost 3/4 of them, typing away there. Are there any others that you see that we haven't really covered that you'd like to answer or sort of dive into before we finish up?
Gopi and Annette, feel free to cut me off. Unfortunately, we can't answer individual questions that relate to your own medical status and conditions and how that applies. That's definitely a discussion for you and your doctor. We encouraged predominantly water intake in this trial, and if a participant was really struggling to meet their water intake, then we also looked at mostly water beverages, so things like tea and that, which was helpful for participants trying to meet their requirements, especially during winter. The winter months, drinking cold water was definitely less appetizing. And related to other studies, there are lots of other studies going on in PKD, but like Gopi said, not in water for us specifically. Annette, Gopi, if you're looking at the questions, feel free to jump on.
I haven't looked at the questions, but
okay.
I've been looking at some of the questions. I think some of them who have been our participants asking about results. Yes, they are available to you. Just contact us. You know where to find us and email us, and you can obtain your results from like the study. I think some people also asked whether we're going to like dig a little deeper into the diet and things like that. As Dr. Rangan and Alex said, like we do have data that we are still trolling through, because as you know, there's quite a large number of you guys, and we've collected data from you at every 6 months. So there has been a lot of data, but this is our main findings for tonight. And we really wanted to get the message out there to everyone, because we know you guys are so keen to find out. But there will be probably some additional results in this space in the coming years. But we have to give us a bit of time to get through that.
A couple of questions maybe I could answer very quickly if we've got time, Carolyn.
Absolutely.
What about drinking enough water to suppress vasopressin? So that was a question from Heather. And so in our study, we found that the amount of extra water that was drunk on average did not suppress vasopressin. But we'll look more closely at the information in the next month or so, because there will be people who suppressed vasopressin and people who didn't, and that will tell us a lot of information.
There was Gopi, I'll just jump in really quickly. There was also a question about even if it didn't impact kidney cyst growth or EGFR, could extra water have improved quality of life in regards to pain and other symptoms? Certainly, anecdotally, we did get feedback of that throughout the trial. We do have data on that. Again, that takes a lot of time. We will get to that eventually.
Shane's got a question just about tolvaptan and just whether passing more urine would make the kidney work harder. And the answer is a converse, that tolvaptan, it's a question about tolvaptan, that your kidney won't be working harder even though you're urinating more. And it is, Claire's just asked about whether it's water intake or fluid intake, and agree with you, Claire, that it's important to just drink plain tap water. That's the key.
Okay, was there one more question, Alex, that you wanted to answer?
Gopi, perhaps we just confirming drinking additional water does not harm the kidney.
Yes, that's right. So from our study, we would say that, but always check with your doctor about how much more you're planning to drink and whether it's appropriate for you and your situation.
Okay. And I think that takes us up to 8 o'clock on the dot. Thank you so much. We can't thank you enough for all your time spending here today, Alex and Annette and Gopi. And I know we've had a lot of comments that have come through also thanking you for your time and information tonight. Is there any final last words that you have to say about the study, or that you'd like to tell the participants that are here tonight, or the trial people that were in the trial with you?
We'd just like to thank you on behalf of all the team for your participation, and we'll just keep going forward.
Yes.
Thank you.
Yes, thank you. And we've learned a lot from you guys as well, so I really appreciate it. Thank you.